Okay, so today we're going to go over a case study with Dr. VanNoy. My name is Dr. Tenesha Ward with Infinity Wellness Center. Dr. VanNoy, also a practitioner at Infinity Wellness Center, and he really likes a lot of the brain chemistry imbalance cases. So depression, anxiety, mood disorders, focus, ADD, ADHD, and we really see this in males, females, a lot in kids, especially this last year with 2020. So, we're highlighting that this month for back to school. A lot of kids have problems with focus, and it could be from stress of the last 18 months. It could just be other things also, but we've seen it more lately, anxiety, depression, things like that. So we're going to start with this case, and we're, keeping the patient's name private, but I will say it's a 30-year-old male. And we again see this in male and females, probably a little bit more in females, but we thought this was a really good case to share. So I'm going to start with why he came in. So I'm going to share my screen, and we have something here called our symptom survey sheet. And this says this is how we monitor all of the patient's symptoms from the first visit on, so we know where we're at every moment. So Dr. VanNoy, will you tell us just a little bit about why this person came in? What were the major complaints?
Yeah, so he came in with the initial, can you hear me? Mm-hmm. Yeah, he came in with the initial complaint of mainly fatigue. And as we kind of got into some history and stuff, some brain fog, low motivation. So also kind of, can refer to low motivation as depression, and then some anxiety stuff a little bit further down. Libido definitely played a part into it, and as you kind of know, that does play back into fatigue. So as the body's fatigued and in a fight or flight stage, it's not wanting to propagate the species and make hormones and digest properly and kind of get into the more of the rest and digest parasympathetic stage. But yeah, so came in, was really looking at fatigue, but as we kind of ran some blood work, which I think I did see flip through that, so we're going to go over that here in a moment. But yeah, saw some blood work, saw some stuff in there through his gut. We know serotonin is made 95% or more in the gut and sent to the brain. So just as the kind of gut cleaned up a little bit and got a little bit better system functioning, there was kind of seeing that we need to do a little more work with the brain. So I went ahead and so after the blood work and getting the diet cleaned up, went ahead and ran the neurotransmitters, which is I think we're going to show here in just a minute.
Yep, we'll get to those for sure. So I think it's worth noting that he came in with anxiety at a 5 on a scale 1 to 10, 10 being the worst. And the last visit, his anxiety was down to a 1. That's huge. Brain fog, a 3, down to a 1. Fatigue, a 6, down to a 3. Like, went from, having a really hard time. Oh, yeah, where's that one? Low motivation.
6 to 3. And then low libido, 8 to a 5. So.
Oh, huge. So, a lot of this brain stuff was pretty, debilitating. There it is. Low motivation, 6 to 3, to very high functioning. So, following the Infinity Way and how we do things, he came in, you did a timeline history, an exam, and then you ran blood work. So that was the first test you ran. So let's look at his blood work. And so you got some data on him. So this is a functional lab range blood panel. Tell us what you kind of saw in the blood work, and why you started with the gut.
Yeah, so just first and foremost, the blood sugar was a little bit off, so just want to make sure he was stabilizing blood sugar. That that does throw us into a fight or flight. So low blood sugar, high blood sugar is a stress on the body. It throws us into kind of a fight or flight mode. So wanted to get that under wraps. But then the kind of bunch there is looking at a metabolic panel. So malabsorption, dysglycemia, is a dysregulation in blood sugar. And some of the adrenal stress, malabsorption, just really getting him to get the adrenals calmed down. Like I said, was the main issue of the fatigue and everything, but also with some malabsorption. If the gut's not producing or having some issues, inflammation, things in the gut, that's, like I said, that is going to mess with serotonin production and getting that up to the brain. And I said, so just getting that under wraps. So saw a lot of that. The homocysteine was a little bit high, so that's neurological inflammation. So just kind of as things came down, that was one of the things that kind of we saw in the beginning that was like, hey, we might want to look at genes or neurotransmitters. So it didn't go the gene route because it was kind of didn't see so much Sometimes genes explain why our levels are that way, but as we started working, it was like everything was making sense. Didn't need to go behind the scenes and run genes. Was like, hey, let's just see where your neurotransmitters are right now and support your system to try to get a better effect after we did a little bit for the blood work.
Okay, so then we ran neurotransmitters, and just so people know, neurotransmitters really are your brain chemistry, your brain chemicals. So we're looking at serotonin, dopamine, GABA, things that really control our mood, anxiety, just how we feel day to day. So here is a neurotransmitter test. So collecting more data.
Right. So yeah, when that came back, we were, serotonin's low. So that was right first and foremost. That really explains a lot. Kind of ties back into the gut. Why I say why gut health is so important to brain health. If we have a leaky gut, we have a leaky brain. If there's inflammation in the gut, there's inflammation in the brain. So yeah, I just wanted to make sure that that was the first step, is a lot of gut work. But then as things kind of healed, we're still seeing he's having some of those issues. And so yeah, serotonin made a lot of sense for that being low. Epinephrine, norepinephrine, those are hormones that come from your adrenals along with cortisol. And cortisol, it was a little bit dysregulated, high in a few places on that chart, but then the norepinephrine and the epinephrine were low. So just a little bit of adrenal fatigue and probably feeling, we didn't track so much sleep stuff. I don't think that was a big deal, but if you probably talked to him when he was getting those high cortisol at night, he may have been waking up, tossing, turning, going back to bed, maybe getting up, going to the bathroom, going back to bed. So maybe not felt like sleep was an issue because, hey, I can go back to sleep. But that's very typical of that high cortisol spike at night, and especially at 4 a.m. in the morning. If you're getting a cortisol spike, and then you're going to wake up to go to the bathroom, to maybe toss and turn, go back to sleep. So he may not have been identifying that as a problem, but yeah, I could probably talk to him a little bit more and be like, hey, was this happening then? And you could probably see that was maybe tossing and turning a little more than now as that cortisol gets to be away from when you're supposed to be sleeping.
And the cortisol and the adrenal fatigue could also explain the low libido, because the adrenals and reproductive hormones are very much related in function. Yeah. And our goal isn't to just, if you go a Western medicine route and you have low serotonin, oftentimes you'll be prescribed an antidepressant, right? Like Prozac. Our goal is an SSRI. Exactly. Our goal is to figure out, okay, your serotonin's low. Why? And you already made the correlation to the gut from the blood panel. And how do we get your body to make its own? So that's where I want to kind of dig into. Like, that's our philosophy. That's what we do. We really want your body functioning on its own, not dependent on a medication or a nutraceutical for the rest of your life, unless it's genetic. Sometimes that's needed. We want to heal and fix your body to make its own serotonin, right? And to, balance the adrenals. So let's just look at a protocol here and kind of tell me, what you did, why you did it here. Yep, I see the dopatone active to balance dopatone. Let's look back at his dopatone quick. So serotonin should be 1.4 times higher than dopamine. We know that to be true, and it's not, right? Serotonin is lower.
Lower, yeah.
Yep, so you needed to fix that. So also, I think it's worth noting, looking at his vitamin D, where's his blood here? There it is. That was also low, like really low. And vitamin D affects mood, energy. We now know with the whole COVID world, it was at 27.9. It affects immune system. We want to see that above 80. So yeah, looking at his protocol, just tell us a little bit. I think this was his first protocol. First and second protocol. Sorry, this is his first and second protocol.
Yeah. So that was, we were looking at, so that was, I think, before we ran the neurotransmitters, we were looking at some more gut health, and then just looking at symptoms and stuff. Didn't have the test back for, I think we used dopatone a little bit, got a little bit of help. I think as we go through, there's a couple of things I don't think you scanned in over there, but as we go through it, I think we finished out that one bottle and switched over to a more the advanced neurotransmitter support, so more of a whole neurotransmitter support, and then got a little bit granular once we got the results back with that, and added the mood plus. So it was like really for focus, really got down to that brain fog. It does have a little bit of, so we did support with 5-HTP. 5-HTP is a precursor to serotonin. And yeah, so it was like, I think we started off a little bit more working on fatigue and gut stuff. And then when we got the results back, we were able to see the actual deficiencies where they were and support those systems. So we moved a little bit away from the dopamine. Through the whole process, we were using adrenal support and a little bit of DHEA support. So even kind of trying to get the adrenals off the ground, getting a little bit more energy, which then returns the body to having to deal with that fight or flight response less, which then will up libido and things like that. So the body's not having to worry about running from the lion. It can worry about making babies and things like that. And then as we get further into it, like I said, just continue with the advanced neurotransmitter support, added the Mood Plus, which is a little bit more for the brain fog and clarity. Could switch up the adrenals a little bit, some more herbals, and then kept him on the 5-HTP. So just the serotonin doesn't cross the blood-brain barrier. So we can give precursors and things, building blocks to help the body build those things. And then slowly, as the body gets used to that system and that cycle and kind of like that muscle memory, can pull back on that. And just as long as we don't go back into old patterns and old diet and things like that too bad and really kind of trash the gut again, can still kind of get these serotonins and building blocks sent from the gut up to the brain.
So yeah, the gut repair right here is our product for gut repair, and it's got an amino acid called L-glutamine that heals the gut. And so yeah, a lot of people come in and say, well, hey doc, I'm having brain fog. Why are you looking at my gut? And I think what a lot of people don't know is those brain chemicals a lot of times are made in the gut. And then of course we had to get the vitamin D up. You know, you did some adrenal support, like all that matters. It all works together. We have to do the right thing at the right time in the right order. Like if you went straight for, the jugular, right? Like if you started just pounding him with precursors for serotonin without knowing if the gut's going to absorb all that stuff, we found out he probably wasn't even absorbing a lot of nutrients to make the right stuff. It wouldn't have mattered, right? He wouldn't have gotten well. So ultimately, though, he didn't stay on this whole protocol. We healed the gut, took him off that. We live in a stressful world. You said you change the adrenals, you kind of build them up and then maybe put them on something that might be a little more supportive. And then, you can get the vitamin D up. Sometimes you can keep that up with sunlight exposure. Sometimes you have to stay on a lower dose. Yeah, good. What would you say overall, just kind of his outcome was last time you saw him? How was he feeling?
Yeah, he was saying and then I think coming in, he was also taking, not only drinking coffee, lots of coffee, but he was taking caffeine pills. So it was on and off caffeine pills, and then knows that when he gets on them, was feeling better short term, but then, within very, very short amount of time would kind of start feeling kind of that mid-afternoon fatigue, that wired and tired feeling. So got back off the caffeine pills again.
Awesome, because that's stressful for your body.
Yeah, so I know we weren't tracking through numbers on the symptom sheet, but in here, written in my soap notes, he was saying that he was waking up earlier without caffeine. So waking up with energy, eyes popping open.
Awesome.
His diet was back on track, and was kind of really feeling all the benefits from caffeine's kind of a double-edged sword. It feels like it does good in the beginning, but it really runs our adrenals on the red line, and so long-term or even short-term use in some people can really flip us over into that wired and tired feeling, throw us into more anxious feelings, all that sort of stuff.
And let's be clear, like, we're not anti-coffee. We don't take everybody off coffee. However, it's I love coffee, right? I love the taste. There's some antioxidant properties. Like, I could argue both sides of the fence for coffee. However, when you're dependent on it for your energy, there's a problem. And we look at the adrenals, and that's exactly what you did here. So awesome job. We're seeing more and more, again, anxiety, depression, fatigue coming in. And yeah, if somebody wants to come in and take a look at their brain chemistry, their blood, their functional blood chemistry, we're at Austin Holistic Doctor, austinholisticdr.com. Myself, Dr. VanNoy, specializes in brain chemistry, can take a look.